Good evening, folks. This evening's topic one of my viewers wanted me to explain medical aid in dying. So tonight's show is about medical aid in dying. And for me, certification is end of life care hospice. So here we go with the explanation. Here's a clear, page grounded explanation of why compassion and choices focuses on authorizing and implementing medical aid in dying based directly on the content of the tab you're viewing. Okay. Why compassion and choices prioritize this work. The organization's rationale is laid out very explicitly on the page. Their focus comes from several intertwined beliefs and evidence-based claims. It is a widely supported end-of-life option. The page states that medical aid in dying, or MAID, has broad public support. 3/4 of Americans favor it. Compassion and choices sees itself as advancing in option that aligns with what most people want at the end of life. It provides peace of mind and comfort, even though relatively few people will ultimately use MAID. The organization emphasizes that simply having the option gives dying people a sense of control, reassurance, and comfort during an extremely difficult time. It is a litmus test for person-directed care. The page frames MAID as a marker of whether a healthcare system truly respects patient values, allowing people to share or to shape their final days, reflects a commitment to autonomy, dignity, and honoring personal priorities. Evidence shows it protects patients. Compassion and choices points to more than 20 years of data from Oregon and additional decades of combined evidence from other jurisdictions. According to the page, these laws have proven safe with strong safeguards that protect against coercion and abuse. It improves end of life care for everyone. The organization argues that authorizing MAID has ripple effects across the healthcare system, including better doctor-patient conversations, better use of hospice, better physician training in end-of-life care. These benefits extend even to people who never choose MAID. It costs states almost nothing. The page notes that implementing MAID requires minimal public spending, mainly data collection and annual reporting, making it a low cost, high impact policy. If you want, we can break down how compassion and choices frames MAID relative to hospice, disability concerns, or their broader ethics landscape, each of which the page touches in different ways. Overview of the page content. The page titled "The Facts About Medical Aid in Dying" explains what medical aid in dying is, who qualifies, the safeguards that accompany it, and the evidence and public opinion that compassion and choices cites in support of authorizing and implementing MAID. What is MAID? What MAID is and who it applies to. MAID is optional. No one is required to use it. No provider is required to offer it. Eligibility requirements. A patient must be an adult, have a prognosis of 6 months or less to live from a terminal illness, be capable of making an informed health decision, and be able to self-administer the medication. Safeguards and procedure checks. The legislation includes more than a dozen safeguards. 2 healthcare providers must confirm the prognosis. At least 1 independent witness and 2 clinicians must confirm the absence of coercion, coercion is subject to criminal prosecution. The page stresses that a person is not qualified solely because of age or disability. evidence on safety and system effects, decades of experience. The page points to data since Oregon's law and other jurisdictions asserting there has not been a uh, substantiated cause of abuse or coercion in those authorized jurisdictions. Systematic beliefs. Systematic beliefs. The page says MAID improves end of life care. Overall encouraging better palliative care, more meaningful doctor-patient conversations, and benefits for families even when MAID is not used. Public and professional support cited on the page. Physician support. The page cites a November 2020 Medscape survey reporting that 55% of physicians support MAID. Public support. It cites a February 2023 Susquehanna poll showing about 79% of U.S. residents support MAID with broad backing across demographic and logistical groups where MAID is authorized according to the page. The page lists 12 jurisdictions that have authorized MAID, including Oregon, Washington, Montana, Vermont, California, Colorado, the District of Columbia, Hawaii, New Jersey, Maine, New Mexico, and Delaware. If you'd like, I can turn this into a one-page summary. You can print, compare these safeguards with other states' law, or extract the exact eligibility and witness language for quick reference. Okay, guys, that is your D for tonight. I'm going to try and do one more show, but I need a break first. So I will be back on shortly with E. For now, Gator Wellness, take care, guys.